1. During an OB technician training session, an instructor uses hands-on simulations to reinforce sterile technique. This instructional strategy primarily supports which principle of adult learning? A. Rote memorization. B. Experiential learning. C. Passive observation. D. Abstract theorizing. 2. A clinical instructor notices a student struggling to properly don sterile gloves. What is the most appropriate initial action? A. Document the failure and report to nursing administration. B. Remove the student from the clinical setting. C. Provide immediate corrective feedback and demonstrate the skill again. D. Wait until the evaluation phase to address the issue. 3. Which method best assesses a student OB tech's ability to respond to postpartum hemorrhage in a simulation lab? A. Multiple choice exam. B. Peer-reviewed group discussion. C. Direct observation with a performance checklist. D. Open book case study. 4. An OB technician preceptor is giving feedback to a student. What characteristic makes feedback most effective in adult learning? A. Delivered once at the end of the rotation. B. Vague and supportive. C. Immediate, specific, and actionable. D. Only positive to build confidence. 5. During clinical instruction, a CNA instructor uses questioning to challenge students to think critically about newborn care protocols. This technique aligns with which adult learning theory? A. Social learning theory. B. Constructivist theory. C. Classical conditioning. D. Dual coding theory. 6. Which of the following best ensures compliance with state regulations during CNA OB technician training? A. Using outdated curricula approved last decade. B. Documenting student progress according to facility preference. C. Following the state-mandated curriculum and documentation guidelines. D. Allowing each instructor to determine evaluation methods. 7. A student consistently fails to follow infection control procedures during delivery room setups. What should the instructor do next? A. Reassign the student to a different unit. B. Issue a written warning and continue as normal. C. Schedule a remediation session focused on infection control. D. Notify HR for disciplinary action. 8. Which strategy most effectively supports adult learners in a hospital-based OB tech course? A. Emphasizing instructor-led lectures. B. Creating passive observation opportunities. C. Facilitating self-directed learning with clear goals. D. Limiting clinical exposure to reduce stress. 9. During a mock neonatal resuscitation, how can the instructor assess teamwork and communication effectiveness among students? A. Reviewing their written reports. B. Conducting a structured debriefing using a teamwork rubric. C. Counting the number of verbal exchanges. D. Asking students to self-evaluate only. 10. A CNA instructor is developing a maternal newborn care curriculum. Which component must be prioritized to meet regulatory standards? A. Inclusion of evidence-based competencies. B. Instructors' teaching preferences. C. Pre-licensure content from a nursing textbook. D. Traditional assessment methods. 11. What is the best way to validate that students are competent in newborn safety procedures? A. Reviewing their reading log entries. B. Administering a group quiz. C. Conducting return demonstrations with performance checklists. D. Allowing students to evaluate one another. 12. A student in clinical training makes a medication identification error. What should the CNA instructor do first? A. Reprimand the student in front of the group. B. Remove the student from the hospital. C. Review the error privately and reinforce proper procedure. D. Ignore it since it was not administered. 13. In adult learning, what instructional technique is most likely to encourage reflection and critical thinking? A. Memorization drills. B. Role-playing with post-activity discussion. C. PowerPoint-based lectures. D. Video observation without follow-up. 14. A student asks for clarification during a postpartum assessment simulation. What is the instructor's best response? A. Tell them to check the policy manual. B. Pause the session to address the question in context. C. Defer questions until the end of the session. D. Ask another student to answer. 15. What is the key responsibility of the CNA instructor when supervising students performing obstetric tasks? A. Allow independent practice after observation. B. Intervene only in emergencies. C. Ensure direct supervision and correction of errors. D. Let students teach one another. 16. When designing a skills lab for OB technicians, what is a critical instructional component? A. Emphasis on theoretical background. B. Realistic practice scenarios with immediate feedback. C. Use of outdated task trainers for cost savings. D. Independent study materials only. 17. An OB tech trainee violates HIPAA by discussing a patient's labor status in a public hallway. What should the instructor do? A. Wait for the unit manager to handle it. B. Review the HIPAA policy in a group lecture. C. Conduct a private teaching moment emphasizing confidentiality. D. Ignore the comment to avoid embarrassment. Maternal newborn CNA OB technician. The maternal newborn CNA OB technician hospital-based OB training plus internal exam test is a specialized assessment designed to evaluate the knowledge, skills, and clinical readiness of certified nursing assistants and OB technicians working in obstetric and neonatal care settings. Administered as part of a hospital-based training program, the exam measures competency in areas such as labor and delivery support, postpartum care, newborn assessments, sterile technique, infection control, and emergency response. Emphasizing adult learning principles, clinical instruction, and regulatory compliance, the internal exam ensures candidates are prepared to deliver safe, ethical, and evidence-based care in maternal and newborn units. Here are the top 5 beneficial uses of the sample exam. 1. Ensures clinical competency. The test validates that CNAs and OB technicians possess essential hands-on skills in maternal and newborn care, such as sterile technique, postpartum monitoring, and neonatal support. 2. Supports patient safety and quality of care. By certifying clinical readiness through rigorous internal evaluation, the test minimizes errors and enhances patient outcomes in labor and delivery units. 3. Standardizes training across facilities. The internal exam promotes consistency in education and performance expectations, ensuring all trainees meet the same high standards regardless of training location. 4. Enhances career development. Passing the test demonstrates advanced specialization, opening doors to new roles and responsibilities in obstetric units. 5. Meets regulatory and accreditation requirements. It supports compliance with hospital and state standards, contributing to accreditation efforts and maintaining institutional accountability.